A chiropractor who broke his back twice and was paralyzed for 3 years just made $92,000 in 4 months with a single StemWave device. Even better, he only performs about 5% of the treatments himself because his team takes care of the rest. And his patients, well, they're finally getting better after years of trying everything else. In fact, he estimates that at least 50% of his patients who were headed for surgery have now canceled their procedures. Hey, my name's Ben. I'm the Chief Brand Officer here at StemWave, and what you're about to see isn't just another success story. It's a blueprint for how to finally treat those cases that keep you up at night, while building a cash pay revenue stream that transforms your practice forever. Now, for context, Dr. Kalani Jose runs a 10,000 square foot health center in Oxnard, California. He's built something incredible. MDs, nurse practitioners, acupuncturists, and multiple chiropractors all working together under one roof. But even with all those resources, he kept running into the same frustrating problem. When patients came in with severe knee pain, frozen shoulders, or hip issues that just weren't responding to traditional care, he had to refer them out. And what killed him is those patients rarely came back. Not because they didn't want to, but because once they entered the traditional medical system, they'd get swept into the cycle of injections and medications and surgery, which is everything he spent 28 years helping people avoid. Now, Dr. Jose's story is unique because he actually became a chiropractor after breaking his back twice. The second time left him paralyzed for years. Chiropractic literally gave him his life back. So when he says chiropractic has its limitations, well, that's not giving up. That's pure wisdom and truth from someone who's seen it all. So he started researching alternatives that could help those cases that he had to refer out. Then when a patient mentioned Shockwave therapy, he dove deep into research. And it wasn't a quick decision. Months of comparing technologies, reading studies, analyzing support systems. Then he called his colleague, Dr. Dustin Barton, who'd used other Shockwave devices. And Dr. Barton's advice was clear. In his own words, he'd switch from other companies to StemWave because the technology and support were far superior compared to other devices. Yet, Dr. Jose was still skeptical. He'd seen too many expensive devices become dust collectors. So, during the first introductory visit of StemWave with his patients, Dr. Jose didn't play it safe. He scheduled 25 of his toughest cases, real patients with real chronic pain. And get this, in just one day, those 25 patients generated $36,000 in treatment plans. Now, although that's incredible, the money wasn't what convinced him. One patient particularly stood out. She'd been coming for chiropractic care for her bilateral hip pain, but after 3 months of no improvement, she'd pretty much given up. She could barely walk into the office. But after her first StemWave treatment, she literally ran down his hallway.
When she was done with the treatment, where she couldn't walk, she was basically running down my hall.
Dr. Jose had to stop and just take in the moment. After 28 years of practice, seeing someone go from barely walking to running in a single session reminded him why he became a doctor. And the best part is, that patient is still running today. Every time she comes in for maintenance, she practically sprints through the office. Now, apart from the wonderful patient results, which always come first, Dr. Jose runs his clinic like a true CEO. He has a COO, a financial director, and they scrutinize every investment. When he presented StemWave's 60-day trial option, they were cautiously optimistic, which is fair enough, but when he showed them the results after 4 months, they had nothing to say or do except smile. Here are the numbers he showed. By day 45, he was completely booked 4 days a week. In his first 60 days with the device, he collected $45,000 in revenue. In just 4 months, he's collected $92,000 total. So, how is all of this possible with just one StemWave device? Well, first, it's the technology. Our device creates true shockwaves, not pressure waves like other devices. To do this, we generate an electrical spark underwater that instantly vaporizes that water at 4,500 degrees Fahrenheit, creating an explosion bubble that produces a real shockwave in under 10 nanoseconds. This matters because only true shockwaves trigger something called mechanotransduction. This is where mechanical energy creates biochemical changes at the cellular level. And as a result of this, your patients feel immediate pain relief because we're actually shutting down the pain at its source. We're converting inflammatory cells into healing cells, and we're triggering your body's own stem cells to start regenerating tissue. That's what a true shockwave can do. So, essentially, this process activates your body's healing without causing any actual damage. That's why patients can feel a 10 to 30% improvement after just one visit. Plus, our device penetrates up to 12 centimeters deep with a focal zone that's 2 to 3 times larger than competitors. So instead of treating a pinpoint area, we're affecting entire tissue volumes. Second of all, it's the complete support system that StemWave gives you. We don't just hand StemWave providers the device and that's it. No. We go much deeper. Once you become a provider, you access a wealth of resources. Clinical protocols, marketing systems, coaching calls, business strategies. And last but not least, it's the business model. Patients gladly pay $1,500 to $2,500 for treatment protocols. Pure cash, no insurance hassles, no authorizations. And if you're thinking that your patients would never do that, well, listen closely to this next section. We make it easy to get patients started on these full treatment protocols with our proven $49 mapping session. This low-cost first visit with StemWave lets patients actually feel that improvement. And once they experience a 10 to 30% improvement on day one, converting them to the full protocol becomes almost effortless. It's basic economics. Better outcomes lead to higher perceived value, which leads you to being able to charge a premium. And that's exactly why practices using StemWave report $5,000 to $25,000 increases in monthly collections. I mean, just think about it. When that frozen shoulder finally moves, when that bone-on-bone knee stops throbbing, when your patients can officially cancel their $30,000 surgery, suddenly $1,500 seems like the bargain of the century. And here's the brilliant move Dr. Jose made that every practice owner should be copying. He immediately trained his team to deliver treatments. His office sits right next to the StemWave room. He can hear when it's running. He reviews every chart, guides protocols, and ensures quality. But his team delivers 95% of the actual treatments. And that's not even the coolest thing that StemWave's brought to his practice. The most powerful transformation Dr. Jose has seen? Well, he estimates that at least 50% of his patients who were headed for surgery have canceled their procedures. Now think about that impact. There are people who thought surgery was their only option, who tried everything else, who were ready to go under the knife. And now they're living pain-free lives instead. Plus, Dr. Jose doesn't just talk about patient results. He's experienced StemWave himself. As a disabled veteran, he lost feeling in 3 fingers from nerve damage. Even while adjusting patients, he couldn't feel those fingers. After treating himself with StemWave, the sensation in his fingers returned.
I injured myself, and I always had ridiculous pain in these 3 fingers. I was one of the very first patients for StemWave, and even when I was adjusting, I couldn't feel the fingers. But today, because of the StemWave treatment and the mapping process, and I highly encourage, if you are going to utilize StemWave as modality in your business, in your practice, make sure that you get really good at mapping, because mapping, hey doctor, so when it comes to mapping, what you do is you use the StemWave unit at a lower intensity and a lower speed, and what you're doing is it's kind of like palpation. You're searching for what really needs to be worked on.
And when his doctors asked what changed, he told them about StemWave. And even they wanted to know more. That's right. Skeptical medical doctors are intrigued when they see these kinds of results because they know deep down that the traditional approach can't deliver outcomes like this. So, if you're tired of referring out your toughest cases and watching them disappear into the medical system, or if you're ready to add a cash revenue stream that actually transforms lives instead of just managing symptoms, click the link in the description and schedule a discovery call with one of our StemWave advisors, just like Dr. Kalani Jose did. Our team will walk you through exactly how this technology works in practices like yours, show you the specific ROI our providers are seeing, and explain how you can try StemWave in your clinic with zero upfront investment. Whether you're looking to upgrade your current approach or add regenerative therapy for the first time, this conversation will give you the clarity you need to make the right decision for your practice. I'll see you on the next one.